Today, we're diving deep into a really complex topic, addictive disorders. We're going to look at the science that drives them, some of their surprising history, and, of course, the very real human cost of it all. So let's get right into it.
I think this Japanese saying just perfectly sets the stage for our discussion. It really captures that haunting journey of addiction, right? Something that starts as a choice, something that feels like it's under your control, can slowly, insidiously, turn into the thing that controls you. It's that transformation we're going to explore today.
So when we talk about addiction, what are we really talking about? Well, at its core, you can think of it like a war on two fronts. It's not just a physical thing, like a craving you can feel in your gut. It's also a deep mental dependence. And that is what makes it so incredibly powerful. Your mind and your body become completely convinced they just can't function without the substance.
All right, so in this first section, let's really get into the science of dependence. Because to truly understand what addiction is, you've got to understand a couple of key concepts. Let's break those down.
Okay, so on the one hand, you've got withdrawal symptoms. This is your body and your mind basically in open rebellion when the substance they've gotten used to is suddenly gone. We're talking about real physical stress, tremors, anxiety, just this intense restlessness. Then, on the other hand, you have substance dependence disorder. This is the result of that withdrawal. It's this compulsive, all-consuming drive to find and use the substance again, pretty much just to make the awful feelings of withdrawal stop. It's a vicious, self-perpetuating cycle.
Now here's where things get really interesting. Let's take a look at the data, because a pretty surprising pattern starts to emerge when you do. You have to ask the question, does addiction affect everyone equally? Well, the numbers tell a very different story.
I mean, just look at this. This slide shows a really stunning gap. According to U.S. survey data, alcoholism is 5 times more prevalent in males than in females. 5 times. That's not a small difference. That's a massive disparity, and it really points to some deep-seated societal and maybe even historical factors at play.
And here's some of that historical context. If you look back, the widespread introduction of some of the most powerful drugs has often been tied to fields that were, historically, dominated by men. During the American Civil War, morphine addiction was so common among soldiers it was literally called soldier's disease. Fast forward to World War II, soldiers were given amphetamines to fight fatigue. And after the war, that use spread to other physically demanding jobs like trucking. This history has absolutely shaped the addiction landscape that we see today.
Okay, so now let's get into the really fascinating part. What's actually happening inside the brain? How do these substances manage to take over? In this section, we're going to see how different drugs can actually hijack the brain's chemistry, creating the very dependence we've been talking about.
You can basically break down a lot of these addictive drugs into 2 big camps. First, you've got the stimulants, things like cocaine and amphetamines. Think of these as the accelerators. They rev up your nervous system, making you feel super alert and active. Then, you've got the sedatives, like alcohol. These are the brakes. They calm everything down, relax your muscles, and make you sleepy. 2 completely opposite effects, but both can be incredibly addictive. Let's take a closer look at something really common, alcohol. Once it gets into your bloodstream, it makes a beeline for your brain. At first, in lower doses, it hits those pleasure centers, which is why it can feel good. But as you drink more, it starts to shut down the more advanced parts of your brain, your logical thinking, your judgment, while also weakening your nervous system. That's what can lead to memory loss or blackouts, and of course the dreaded hangover, which is pretty much just your body screaming that it's been poisoned. Now, opioids like morphine and heroin, they take over the brain's chemistry even more directly. Users often describe this incredibly intense initial rush of pleasure, which is then followed by hours of a relaxed, almost dreamlike state. What's happening on a chemical level is that these drugs are just flooding the brain with endorphins, the body's own natural painkillers. The brain gets this massive, overwhelming reward signal, and, frighteningly, a physical dependence can take hold in as little as 30 days.
So we've talked about the individual, but the impact of addiction, man, it just ripples outwards. It sends these massive shockwaves through families, through communities, and through society as a whole. Let's take a look at the staggering costs.
Just look at this number, -12 years. Let that sink in for a second. That's the average number of years shaved off the life of a person with alcohol addiction. That makes it one of the top causes of premature death, right up there with things like heart disease and cancer. It's absolutely chilling.
And the cost to society? It's just immense. In America, alcoholism is a factor in half of all murders, rapes, and accidental deaths. It's linked to 40% of physical attacks and 30% of suicides. This shows you it's not just a personal health problem, it's a massive public safety crisis, fueled by a substance that shatters judgment and completely lowers inhibitions.
And here's the thing, the process of quitting can be just as dangerous as the addiction itself. For heavy drinkers, stopping suddenly can trigger something called alcohol withdrawal delirium. It is a terrifying state of psychosis. The person can experience vivid, horrifying hallucinations, seeing things like snakes or rats, along with severe body tremors and just this overwhelming acute fear. It can actually be fatal.
And if you think that sounds bad, opioid withdrawal is just brutal. While it's not usually deadly in the same way, people describe it as excruciatingly painful. The body goes into a full-on revolt. You're talking about symptoms like the worst flu you could possibly imagine: cramps, vomiting, severe restlessness, and you can't sleep. It's this intense suffering that so often drives people right back to using the drug, just to make it stop.
So, after hearing all of this pretty bleak picture, you might be wondering, is there any hope? Is recovery even possible? Well, in our final section, let's look at the path back. It's incredibly difficult for sure, but it is not impossible.
The path to recovery isn't a single event. It's a process, a multi-step journey. It has to start with a medically supervised withdrawal to safely manage those severe symptoms we just talked about. From there, alternative medications like methadone can sometimes be used to satisfy the body's craving and break that cycle of use. That opens the door for what is arguably the most crucial step: psychotherapy, to help address the underlying behavioral and social issues. Then, the final goal is to eventually taper off those medications too, leading to a life free from substance dependence.
But it's so important to remember that recovery is not a one-size-fits-all kind of deal. The whole process becomes much more challenging when someone is also dealing with what are called co-occurring conditions, where addiction overlaps with other mental health challenges, like personality disorders. These issues can create this incredibly complex web of challenges that really require specialized, integrated care.
So, where does all of this leave us? We've seen how addiction can literally rewire the brain. We've seen how it's been shaped by history and societal pressures. And we've seen how it's all tangled up with a person's individual psychology. Which brings us to the big, complicated question: is addiction a disease? Is it a choice? Or is it something far more complex, sitting somewhere in between? It's a lot to think about. Thanks for joining me on The Explainer.
For the next video, like, share, subscribe this channel and don't forget to comment in comment box.